Today we will be discussing tactile stimulation and the effects on kinematics of the equine gait. We'll look at the application and effectiveness of the intervention, as well as compare the stimulus to other therapeutic techniques, and lastly identify the impact of the stimuli on the musculoskeletal system. Equine lameness is ever prevalent within the UK, Ireland et al. 2013, yet it's difficult to quantify exacting numbers due to the fragmented nature of the central database of the non-racing population of equines. This is further impacted by the non-essential microchipping and passporting laws, Bowden et al. 2013. Therefore, equine health data is collected on a small scale periodically. Murray et al. 2010 estimated that 33% of dressage horses have had a form of lameness at least once within their ridden career. Yet this data is discipline specific, therefore it's difficult to extrapolate to multiple sports due to the various stresses and strains exerted on the equine from other disciplines. This is further backed by Dyson et al. 2013 from a study investigating the proportion of lameness in the sport horse population. This study concluded out of 506 equines examined, 47% showed a form of lameness or gait abnormality. Further research from Welsh et al. 2016 states that 66% of all equines have a recurrent or chronic condition, of which osteoarthritis accounts for 13.9% of the overall total. This form of data collection primarily relies on owners' perception of lameness or laboratory findings, which can often cause bias or skewness in data. A study into early behavioural indicators to the chronic onset of lameness by Dyson et al. 2018, by which a ridden horse ethogram has been created to help assess pain and discomfort in the ridden horse and aid in the early prevention of chronic lameness. Equine lameness is defined as functional abnormalities or alterations to the gait which are caused by a structural or functional disorder to the locomotor system. Abnormalities are easiest to see at trot, with several objective studies indicating that the most reliable kinematic lameness indicators being the vertical movement of the head for forelimb lameness, or asymmetry of movement or reduction of flexion in the hind limb. Butcher et al. 1996. Tactile stimulation can be used in physiotherapy or rehabilitation with the application of a jingle bracelet or bell boot, pastern or coronet band. A study from Clayton et al. 2008 investigated the effects of a stimulus applied to the pastern of the weakest limb in both the fore and hind limbs in 9 non-lame equines, further observing the flight arc and peak flexion angles as well as measuring ground reaction forces. This study found that the application of a stimulus to the forelimb did not significantly impact the kinetics of the equine gait and did not alter ground reaction forces. This study concluded that the initial application of a stimuli caused the greatest deviation to the gait, yet this diminished over time but still had a positive effect on limb range of motion and proprioception. Clayton furthered this study in 2010, looking at the application of a stimulus to the weakest hind limb and found that the peak height of the hoof flight arc increased threefold during the swing phase, yet there were minimal kinematic responses in the coxofemoral joint. Additional research was conducted by Jensen et al. 2018, whereby a bell boot was applied to the weakest limb for an hour 3 times a week over a 6-week period. The equine symmetry was assessed with the use of acoustic myopathy, also referred to as AMG. Jensen found that the application of a bell boot increased the fiber activation within the muscle, therefore improving the equine's coordination, which is further underpinned by Clayton et al. 2010's findings of the increased flight arc and increased activity in the hind limb joint angles. All horses within this trial had a stimuli applied to the left hind limb and were exercised in walk, trot and canter on both the left and right rein. The data collection showed a significance with the muscular activation of the gluteus superficialis, with the primary function of this muscle to induce flexion to the coxofemoral joint as well as the protraction and retraction of the hind limbs. A positive improvement to the muscle activation was observed with the application of the stimuli to the left hind limb in walk and trot on a left rein circle, yet showed a significant improvement to the muscular activation on the left hind on the right hand canter. This may be due to the fact that this is the weight-bearing limb. Jensen concluded that the use of a bell boot on an intermittent basis can have an overall positive effect on the muscular imbalance in the equine, yet this paper lacks solidarity as there was no controls used within the trial. Therefore, it can be argued that the ailments could be corrected with no intervention. The ability to implement early intervention prior to clinical lameness, such as tactile stimulation, can help alter gait kinetics and kinematics, which may aid in the prevention of the onset of lameness. The application of a tactile stimuli has shown to have a positive effect on the muscle engagement in the hind limb during extrinsic and contransic activity, therefore causing an alteration to the kinematics of the equine gait. The stimulus can be used positively to manipulate the equine's gait and increase joint range of motion, which will further impact the kinetics of the equine limb, as shown in Clayton's study in 2008. A lame horse or a horse with weakness on a specific limb will offload the limb where there is pain or where weakness occurs, which will subsequently alter the kinetics and ground reaction forces. The offloading of this limb will increase the ground reaction force and cause additional weight to be placed on alternative limbs. This can cause secondary lameness due to the additional compensation, thus highlighting the importance of early intervention of preventative measures to ensure that the horse is symmetrically distributing the weight throughout the limbs. Linking back to the study by Dyson et al. 2018, understanding the equine's ethology can help understand their behavior. The horse is a prey animal, therefore is reluctant to show pain due to the evolutionary behavioral characteristics. The horse will compensate and conceal pain, much the same as a wild horse will try to mask pain to avert being hunted by a predator. Therefore, the owner's ability to identify pain in the horse is not underestimated. Both poles and hydrotherapy can be used with a similar concept as tactile stimulation with recognized improvement of muscle strength and joint range of motion. Hydrotherapy is a widely used and recognized therapeutic and rehabilitation technique. Hydrotherapy is used to prevent and treat musculoskeletal injuries and aid in the improvement of gait abnormalities. Prankel et al. 2008 identified the beneficial factors of hydrotherapy, which will alter depending on the height of the water, with various steps impacting the kinematics of the equine gait. Increased water height was found to cause a decrease in stride frequency. Water height showed to increase stride length and reduced ground reaction forces most effectively at mid-metacarpal height. Yet if increased to mid-carpal, subjects began to display signs of asymmetry. Poles are a common resource often readily available, with research backing the positive effects of which the poles have on the equine kinematics. Clayton et al. 2014 investigated the effects of the use of poles on hind limb kinematics and kinetics. The study found that there was a modification of the trajectory in the swing phase caused by the alteration in the muscular activity from the motor cortex, thus increasing the proprioception and limb protraction and retraction. Clayton further investigated the kinematics and kinetics of a horse trotting over poles. Clayton found the poles caused a reduction in hind limb stance phase, yet had a positive effect on the range of motion of the stifle and tarsal joints. A reduction in speed of the gait was observed, as well as an increase in the height and duration of the stride. A comparison can be drawn between the various therapeutic interventions, as although they have shown to alter the equine kinematics, it is not fully understood to which muscles are directly impacted. This could be further researched with the use of AMG. Yet it could be argued that tactile stimulation has a more targeted effect to the weaker limb and more effect in the musculature imbalance. Exercise-induced muscular adaptation will depend on the interaction of exercise and muscle fiber types. The application of tactile stimulation will have a predominant positive effect on type 1 and type 2A muscle fibers due to the submaximal form of respiration performed during exercise. The stimuli aim to increase mobilization, which in turn influences the production of mitochondria and regulates protein synthesis through the provision of oxygen within the red blood cells. This will have a direct impact on the hypertrophy of the muscle. Increased range of motion has a direct impact on the equine's performance, as it has an immediate influence on the stride length and tracking distance. Due to the sagittal plane of movement of the equine's limb, the application of a stimuli will have an effect on the protraction and retraction and further the range of motion. To conclude, the application of a stimulus has shown to have the greatest positive effect on the sensory motor nervous system and the knowledge of dynamic locomotion due to the increased stimulation to the peripheral receptors and the efficiency of the type 1A and the type 2 afferent fibers. The application of a stimulus has shown to have a positive effect on the peak height of the flight arc, as well as increasing joint flexion angles in the tarsal and stifle joints. Further, there is no conclusive study that evidences the efficiency to which the horse rehabituates to the stimuli, yet studies have shown that the length of time of which the stimuli is applied will impact the functional outcome. Clayton concludes that the application of stimulators for short periods of time between 50 and 100 meters at trot is recommended when the goal of rehabilitation is to maximize muscle facilitation. If rehabilitation is being used to mobilize joints or improve strength of atrophied flexor muscles, longer periods of treatment between 200 and 300 meters at trot are appropriate. This is when muscle imbalance will be aided. Lastly, Jensen suggests that application of a stimulus to the pastern would be more beneficial at walk due to the fact that the horse is not relying on elastic storage within the gait of trot. Overall, the concept of the application of a stimulus to the distal limb shows some scientific significance, yet could be furthered into the field-based trials to look at the long-term effect of equine's performance.